With that, I'd like to introduce our next speaker. We're fortunate also to have Ann Albert as our second speaker. Ann is the Executive Director of Age Better Incorporated. It's a local nonprofit located here in Madison. Age Better Incorporated is a parent organization of sharing active independent lives, or known as SAIL, and that was founded in 2005 and has served as the SAIL program director from its inception to April of 2018. SAIL is a unique membership association and is a charter member of the National Village to Village Network. Participants will learn today about the growing village movement happening throughout the nation. This session will include how a village model can be a solution for seniors who wish to live safe and connected lives by forming an association that promotes a pay-it-forward volunteer service program and provides an array of services, social opportunities, and educational programs. Wisconsin's first village, the SAIL Shared Active Independent Lives, is located here in Madison, Wisconsin, and is considered to be the second oldest village in the nation. I had the personal pleasure of presenting to the SAIL organization about a year ago, and it's a great organization, and just very thankful to have Ann Albert as our next speaker. So Ann?
Thank you, Neil. Can you hear me?
We can.
Okay, my internet seems to be stalling. I just started happening, so I want to be sure that people can hear me, and maybe you can send me a message or something if there's a problem.
We do see your slides, and we are hearing you.
Okay, it's not coming through on my audio, so I apologize. It just started happening.
The audio is coming through, and we do have your face as a presenter. Okay.
Can you hear me okay?
We can hear you, yes.
So okay, so it's not cutting out?
No.
Okay, maybe just send me a message or something if it is. Okay, so good morning. I'm delighted to have the opportunity to share the village model with you today. Before we get started on the actual village model, I'd like to share a little bit of my background and that of Age Better Incorporated and our connection with the village movement. Age Better is located here in Madison, Wisconsin. We're a 501c3 organization. Age Better has member organizations who are founding members, Oakwood Village and Attic Angel. Together, these organizations have over 200 years of experience combined, providing housing and healthcare services to older adults as life plan communities, or otherwise known as continuing care retirement communities. Both are nonprofit. In 2005, they founded SAIL, Sharing Active Independent Lives, which shortly after became part of the village movement. I came on board just prior to SAIL's launch when it was a concept plan, and I had the privilege to help facilitate its development. My and perhaps your first question might be, Why would two retirement communities want to invest in a model that actually helps people live independently in their own homes? I'll talk about that shortly when I talk about the motivations. I do want to acknowledge the amazing vision and the commitment these two organizations have demonstrated these past 15 years. They have remained vigilant about allowing and encouraging SAIL to evolve into what is known as the Village, to operate more or less as a grassroots organization driven by its members and their needs. In 2018, following a strategic planning meeting, Age Better created 3 more program initiatives. And I will share those with you as well. Those include senior housing as a priority, affordable senior housing. You may not be aware that the share of 65 plus age renters throughout the country who are rent burdened increased from 43% in 2001 to 50% in 2015. We are currently in the application process with the City of Madison, hoping to receive funding and zoning approval, as well as tax credits through the Wisconsin Housing and Economic Development Authority to allow us with our partner, Gorman and Company, to build a 75-unit senior affordable housing project and to integrate the Village or the SAIL model with that as a way to support older adults in the communities that they live. Hopefully this has given you a little background and understanding about how SAIL, Sharing Active Independent Lives, Wisconsin's first village, actually began. As I said, we'll do an overview or give you an overview of villages and the Village to Village network and learn about how a village operates and how we help older adults live safe, connected lives. We'll also share about Wisconsin's first village. What is a village? This is a very general description of the village. You can see there are 3 key words I consider key. And those are membership, connect, and community. If you heard my infomercial before the Triad Conference, you heard me say, if you know one village, you know one village. Villages are as unique as the members and the communities they exist in. And we all know that aging successfully is not a one-size-fits-all proposition. Our needs and our assets are unique for the most part, and yet in some ways they're all the same. The beauty of the village model is that it lets us be unique and at the same time glean from others around the country who share some of the same challenges and are finding creative solutions as we age. How and when did the village movement start? I've got a picture here of one of the women who founded the beginning of the village movement with Beacon Hill Village. The very first village, Beacon Hill, was founded 20 years ago. It began in the living room of Susan Morse, who's pictured here on the left, and some friends of hers living in the Beacon Hill neighborhood in Boston. They were talking about what they wanted to do when they grew older and how they wanted to live in the neighborhood they loved as long as possible while they aged. They talked about the various challenges they were currently facing and those challenges that they anticipated. They came up with a solution. They banded together and created what is now called a village, a membership of older adults, a membership that older adults who help one another, create meaningful social connections, connect with the community offerings, such as exercise classes, tours, lectures, social services. They draw from services that are either provided by the village staff or connecting with village-vetted service providers that help them maintain their homes and assist them personally. Why the village model? Why is it important? I'll share some of the additional motivations that we, Age Better, had in starting our village sale. These are the same for other villages as well, who are thinking about the larger picture in the future of aging in our society. I remember the words that were said during one of our earlier focus groups from one of our charter members, Tom Pott, 15 years ago. He listened to the presentation or the concept of what we were trying to create, and he said, "This is good social policy." One of the main motivations had to do with the age wave. We've heard statistics throughout the Triad Conference about the demographics. Just to give other perhaps additional demographics, until the year 2029, we have 10,000 people who will turn 65 on a daily basis. Amy mentioned that as well. In 2030, 1 out of 5 people will be 65 and over. In Britain and the United States, roughly 1 in 3 people older than 65 live alone. And in the United States, half of those over the age 85 live alone. There are more people 65 and older than any time in our history. In 2006, just to give you an idea, there were 37 million US citizens over the age of 65. In 2030, there will be 71.5 million. The other motivation is the worker shortage. The population of workers, especially caregivers, who are in the demographic caring for older adults, is definitely not keeping pace with the needs that exist. We have the opportunity to develop unique solutions because we have boomers, we have seniors who are increased self-directed care and long-term planning goals. We are creating new approaches to aging, and we know that we're unable to build enough senior communities, nursing centers, and retirement facilities to meet the needs of our older adults as we progress in society. We know that we are lacking affordable housing options. In addition, aging in the community is the preferred choice of older Americans and is often affordable and an available option. You can see the statistic through AARP. 8 out of 10 older adults, 50 and over, want to stay where they live. 90% of people 60 and up want to stay in their homes. And then finally, we also see the rising costs of care. The costs of care that I have listed on this slide are very conservative. I do know that for the most part, these are very low costs of care in today's society. Other reasons why the village movement is important. Villages are well positioned to improve the population health of the communities they serve. The village model fills gaps. We find solutions. We hold and we help older adults, help them engage more deeply. We're there when our members need us, and we offer safe ways to meet new friends. We promote health and well-being, personal safety, and more. As a membership, older adults are investing in their future aging by investing their time and their talents and their ability, if they can, to pay membership. Most of our models offer sliding fees for those who cannot afford it. The model is such that only a portion of the village members actually access or need direct service from the office. This allows villages to provide a very personal touch to their members, to older adults. Members are also self-directed. They determine their own desired level of participation. Research shows 60% of health outcomes are based on behavioral, socioeconomic, and environmental factors. Villages are gaining visibility for complementing the current healthcare and social service systems by filling gaps and creating stronger connections for its members. Villages support safe and healthy aging. Through public and private partnerships, its members and their caregivers and other villages and healthcare providers, villages become aware and learn about the risks facing older adults, and we focus on prevention. I know at SAIL, all of our benefits have a prevention focus. Villages are providing solutions and mitigating risks that are so common to older adults, causing them to lose independence. For example, you can see on the slide, accidents and injuries, mainly falls or injuries that occur in the home. We provide safety assessments, home adaptations. Some villages even offer a daily check-in service. Adverse drug events. Early on at SAIL, we learned through our members the definite problem that exists with polypharmacy and various drug events that occur because members perhaps had multiple medications, or people aren't aware of some of the effects that can happen when combining medication with supplements or other substances. We learned about that, and we helped get that message out in the community. And many villages offer direct resources such as medication reviews or education for their members. Loneliness and isolation. We've heard a lot about that, especially during this pandemic. Villages offer small and large group activities. Of course, now those activities are happening virtually. We offer volunteer opportunities, transportation, friendly callers, which again, with the pandemic, are very, very important. We connect people safely and in meaningful ways. Isolation and loneliness present health risks equivalent to smoking 15 cigarettes a day. Isolation is also associated with a 50% increased risk of dementia. This is especially one of the main reasons villages can make a huge impact on older adults, especially those living alone, with the various ways that villages reach out to its members. We have poor management of chronic care conditions or health conditions. That is a risk faced by many seniors, sometimes due to simple things like not having a ride to a doctor, or perhaps not fully understanding what a doctor has communicated or one of their healthcare providers due to a hearing loss. Villages have volunteers who act as advocates, who can help by attending an appointment with a member or bringing them to an appointment. We can help with helping to connect older adults with personal care attendants, vendors, or service providers who can help them track and manage some of their daily living, such as medication routines and other safety factors at home. We have ageism. That's a risk that we don't always hear about. It's kind of an invisible sort of thing. Ageism is a systematic stereotyping of and discrimination against people because they're old. Villages provide opportunities for its members to defy what is known as ageism. We demonstrate every day the incredible value of people who have experience and wisdom, resilience, and more. Studies have proven that people who have positive self-images increase longevity by 7.5 years. In fact, older people who have positive images about aging are 44% more likely to recover from disability. Villages also help members stay strong and improve their balance and their overall physical well-being. They help people adjust to sensory losses. I remember one member, after a particular health event that had lasting effects, referred to getting used to her new normal. Villages help members with that, and we connect members to people and other members who may have had experience or expertise making those adjustments. Computer or phone scams continue to be a growing risk, as Amy pointed out as well, to older adults. These threaten all of us daily in financial and emotional ways, sometimes even our personal safety. The Village Office provides support and advocacy to its members, and the Village provides its members with connections to experts who can assist them if they have had a bad experience. I can't tell you how many times we have had members call the office just needing reassurance or perhaps needing immediate service because, unfortunately, they realized that they were scammed or that they had just allowed permission for a scammer to work on their computer or get into their files. It is very sad and very frightening. Villages assist members to prevent financial and other abuse. Villages help protect members by providing volunteers who are vetted and trusted, as well as providers. Some villages even have providers who are called daily money managers. These are certified professionals who can assist an older adult with bill paying, managing accounts, etc., and advocate for them when needed. Members have the peace of mind knowing the person entering their home by vetted service providers and volunteers, and they know that these individuals have been screened and or vouched for by fellow members. They know the office is there to advocate for them if something does go wrong. These are wonderful ways to prevent loss of independence for older adults. Many times we're asked about the business model of the village. I'd like to talk about that. There are 4 main business models typically. SAIL, Sharing Active Independent Lives, is, for example, a parent-sponsored model. We're affiliated with Oakwood Village and Attic Angel through the nonprofit Age Better. Most of the villages throughout the country, however, consider themselves grassroots. All villages are nonprofit. We have some who have been able to expand in their local geographic area and have created hub and spoke models. These villages share collectively, as you can see, the back office, administration costs, etc. And they have spokes who are basically operations in different neighborhoods and communities. There are even villages who have partnered with Time Bank, and that is also another option. As I said, to know one village is to know one village. We do have self-governing guiding principles. We are grassroots, meaning the membership is who drives the services and the resources and what is provided. We consolidate and we coordinate services. When I think about most villages having paid staff, we really act as conduits for our members. Villages create also innovative partnerships that leverage community resources. When we live in communities, especially such as communities within Dane County, we are very fortunate. There are many, many wonderful resources in our community. It's very important that we try not to duplicate and that we complement and we help one another. Villages offer holistic, person-centered, consumer-driven services. Villages don't have clients. We have members. It's very different mindset in how we operate. We promote volunteerism and civic engagement, and we encourage intergenerational connections. Villages have a combination of paid staff, volunteers, and community-based partnerships for the most part. However, there are some villages who operate as all volunteers. For the most part, villages facilitate connection, as I mentioned, to existing services. We help members navigate medical, non-medical, and social support needs, helping them to create social networks and expand the social capital that we have to support aging and community. As with the business model, the operations vary greatly. As I said, some villages are all volunteer. Most have paid staff. Approximately 80% of the villages across the country have paid staff. But all villages promote and consist of significant volunteer service. The average village has about 80 active volunteers. Some have less, many have more. Village models vary in their membership dues. Some have household membership rates and some have individual rates. Many villages have up to 3 tiers of service, of membership, I should say. Full service, perhaps associate, and social. Some have sliding fee memberships. Actually, most of them do, recognizing that we want to include any senior who wants to be a part of the village. And we offer scholarships to support people who are income challenged. Annual dues for the village range from free, for example, people joining an all-volunteer village, or up to $1,200 per year. The average, I would say, of village membership dues per year is approximately $500 to $600. At sale, our full-service membership dues are $395 per year. Villages partner with local community agencies, as I mentioned. We seek to not reinvent the wheel, but to promote awareness and connections to the resources that exist. We partner on projects, and we see the value of supporting other organizations. To give you an example, SAIL, a village, has leveraged its access to the community's strong medical resources, higher education, and abundance of high-quality nonprofit organizations. Some of these include Safe Communities, RSVP, Triad, Plato, that's the Participatory Learning and Teaching Organization, and UW Retirement Association, Madison Community Foundation, United Way, Pharmacy Society of Wisconsin, Rotary clubs, and more. It's really helpful for villages to continually survey older adults, get to know them, engage, and invite them to work on projects, invite them to work in tandem with these community agencies, and to also do a fair amount of what is called asset mapping within the community. Member benefits include a wide range of social supports. Services provided by volunteers are typically transportation and errands, light repairs, caregiver support, and respite. Discounted services are provided by providers that have been vetted and community partners. Some of the main services include transportation again, home maintenance and repairs, and personal health care or home care. Social activities are provided by all villages. I would say, in general, the social connections are one of the most top reasons why older adults join the village. Educational programs, exercise classes, attending those, whether it's virtual or in person, provides many opportunities for members to connect with one another. Villages partner in formal ways as well, not just collaborating, but formal partnerships. And it's been exciting to see over the last 15 years the many different ways villages across the country have created these formal partnerships. And here are a list of some of the examples of partners of various villages. The village membership, on average, has approximately 146 members. You can see they're spread out in terms of geographic locations. 42% offer tiered memberships, and as I said, most offer scholarships. The growth of the village movement continues. This is very exciting, and it's been exciting to watch. In 2002, we started with one village, Beacon Hill. You can see how we've progressed through the years. Now there are 280 villages and 80 in development. Village activity is in 42 states in our country and 5 countries. We're estimated to be serving approximately 40,000 older adults. Here's a map taken from the Village to Village Network website, and you can see where all these villages are located. And it's obvious that there are a great number of villages on the coast, very few in the Midwest. I would love to see Wisconsin placed on the map as a village hub. It would be wonderful to see that. And I hope that you'll consider that as you think about your own communities and neighborhoods where you live. I'm going to take a moment and ask if there's any questions. Neil, could you check on that for me?
And we do not have any questions from the audience. However, I have one.
Great.
From the standpoint of, you mentioned Attic Angel and Oakwood West.
Mm-hmm.
Is someone living on their own in a private residence close to these facilities able to join?
Yes, so all of SAIL, well, I shouldn't say all, the majority of the members of SAIL live actually out in the community
Oh,
as part of our village. So thank you for bringing that up. And that is why when, for example, I started working with Age Better, my first question is, why are you two retirement communities interested in creating what is now called a village? It seemed counterintuitive at the time. But what they explained is that looking ahead, and this was 15 years ago, they had a lot of vision and they were looking at the demographics and the projected growth of older adults and population and the need for services similar to what you might find in a life plan community are brought into the home so people can stay safe and healthy in the homes that they love. That I thought was really brilliant. There is no way that we as a society can build enough senior congregate living communities for the need that will exist. And we're already seeing it. Nor can everyone afford to live in a life plan community. So offering a village model and bringing it also to affordable housing communities and other senior congregate communities can offer an additional level of support and programming that will hopefully help people age in place and stay in their communities longer. That's a long answer.
This is a wonderful model from the standpoint of its members helping members.
Yes.
And mutual support, and not relying on or burdening local governments with helping out. However, they're certainly there to assist in making it possible for members to know about the services available.
Right. Yep. You're absolutely spot on. That was definitely part of our motivation as well in creating SAIL, is recognizing that opportunity.
And from the map, I see that we have, what, 2 programs or villages in Wisconsin?
Right, yeah, I was going to mention that. We are really excited. A couple of years ago, Felician Village in Manitowoc opened. And we provided a little bit of an assistance with them. The nice part about having our national association is that the National Association helps newly developing villages by offering a mentor to work with them. We assisted Felician Village. We are also excited because in the central state of Wisconsin, north of Madison, we have a group that is actually forming and planning to launch a village. And I've also visited some of the communities in Bayfield, Washburn, and those areas of northern Wisconsin who have also expressed interest or wanted to learn a little bit more about the village movement. And I wanted to mention that as well. I learned a lot. I spent some time visiting with the University Extension individual from that extension, as well as a woman who leads a nonprofit for older adults up in the Bayfield County area. And they invited me to visit and talk with members. And so it was kind of like just basically a town hall type of meeting. And we talked about their older adults and what they need in their communities. And what we learned and what came out really loud and clear, and this may be true for many different communities, is they had a village. It's basically, they had that village model up and running and didn't know it, although it wasn't the formal village. And I think the advantages of creating the formal village or the actual organization is that it can offer some of the safety or privacy mechanisms that don't exist if it's completely informal and grassroots. So it seemed like it was exciting because they already are helping one another. The smaller communities, they don't have an abundance of, say, electricians, carpenters, handymen, or window washing and things like that, those companies. So the need, for example, the vetted service provider or concierge service maybe wasn't as strong, but other needs existed that they would really focus on, such as the socialization, transportation, getting to medical appointments, things like that.
It was encouraging to see that from 2016 to 2020, you had about a 50% growth. I could see the exponential advancement of this going forward into the next decade. It's a wonderful concept.
Thank you, Neil. We're excited too. It's exciting to see the growth. So I thought I would talk about SAIL, Sharing Active Independent Lives. It's Wisconsin's first village, and of course near and dear to my heart. And that might give people kind of a more familiarity, better level of familiarity with the village itself. So you can see here, we're celebrating our 15th anniversary this year. It's not been really the year that we were banking on. I think we're going to celebrate again next year or the following. But SAIL is a wonderful membership organization. I think we're probably the only village that really isn't a protege or, gleaned off of the original village or the village model. We didn't know about Beacon Hill. And I remember the day as if it were yesterday when we were in our office, the staff and I just started SAIL. And one of our members, who is now 99 years old, living in her own home, came racing into the office and waving the newspaper, her Wall Street Journal or New York Times, and was showing us the article all about Beacon Hill Village. And she said, "Oh my gosh, here's an organization just like ours." So that was our introduction to the village movement. The fellow on the ladder on this slide is John Porto. I want to also give a shout out to John. He is one of our beloved handymen who came on board with the village probably 12 years ago, 13 years ago. And he has provided the most amazing service to our members. He's not only their handyman, and we have other handymen like John too, who become friends with the members, and they really care deeply about these people. So I just wanted to make that mention. We at SAIL have a mission to enable members over 55 to live secure, engaged lives on their own terms. We wanted to keep that mission statement very simple, but meaningful. And how do we do it? Well, we're designed to help people stay independent by staying connected. We're the pathway to relationships and resources for older adults who want to live in the homes and the neighborhoods that they love. I want to mention we have at SAIL, as an example, 500 SAIL members living in approximately 400 households throughout Dane County, mainly near or in Madison. That's kind of the geographic area. We have 4 dedicated SAIL staff members who work in partnership with our members and the community. We basically altogether have an equivalent of about 3.25 FTEs working with our 500 members. It's amazing to see what can be accomplished when you have a team like we have, along with the support and assistance of our members, our member organizations who help us, service providers, colleagues, volunteers, and more. We are very fortunate, but think about that in terms of infrastructure. I think most villages are very similar. We've done studies in the village network about the ratio of staff to members and volunteers to members. We at SAIL might be slightly under that, but basically that is kind of the ratio. And there you can see that the emphasis has to be on connecting, coordinating, being the conduit, and then again, tapping into those amazing resources of our members as far as their talents, their experience, their sweat equity. This is really what makes the village work. The village focuses a lot, as I mentioned, on volunteering. There goes John again on the ladder. I guess I have the same picture. And our ladies driving and at the computer. So yes, we do promote a pay it forward philosophy. In saying that, it's basically the philosophy that, and this is based on years of experience, hearing people say, oh, I love the concept, I'll join when I need it. We're trying to encourage people to join the villages before they need it, or maybe while they need it, but to really not discard the idea of joining because of your age or where you think you're at in a functioning perspective. We want to encourage people, join because someday you might need it. And members who are charter members of SAIL joined 15 years ago. Those were some of their words early on. And it's really beautiful to see how someone might join and then eventually, or maybe just for a temporary basis because of surgery or some sort of health event, where all of a sudden they might need some help. So this is a really gratifying, I think, theme that we have or emphasis. We know that volunteers bring such value to the organization, and it helps them. It increases their personal value, makes people feel good to volunteer, and we hear that all the time. We have many membership benefits at SAIL. I really want to stress, and this is true of all villages, the member benefits that are provided, and with SAIL, this is 100% true as well, are inspired or created by the members. We talked about earlier, each community is unique, each person is unique. There is no one size fits all. I think that's the beauty of the village model. We started in 2005, early on, one of our members, for example, said, I live alone in my house. No one would know if something happened to me. I'm not friendly with my neighbors, or they come and go. So no one would know if something happened. Another member said, I live alone and I'm concerned about my cats. If something happened to me, no one would know. My cats would be left alone. That led to the creation of our automated morning daily check-in service, Rise and Shine. That same member who gave us the idea also said, I'm retired now and I don't want someone calling me. I'm busy. I don't necessarily want to chat. And I also don't want to be awakened at a certain hour. We basically created a daily check-in system that relies on caller ID. The member makes the call to the village. We see that 7 days a week we check, and by 10 a.m., if one of our Rise and Shine participants doesn't call in, we phone them. We also may check with some of the contacts they gave us in advance. And if all else fails, we, the village staff, actually go to their home to check and make sure they're okay. This brings great peace of mind to people, and it's one of our, I think, most important benefits. Approximately 35 to 40% of our SAIL members live alone. So this is a very, very important service. We also just created another benefit recently, and that was the idea of one of our original members, the woman I mentioned earlier, Lois, who is 99 years old. She said, you know, I would feel much more comfortable if I had the peace of mind knowing I could contact the village after hours and talk to someone in person if I have a problem that needs resolution before regular office hours. We partnered with one of our service providers, Bright Star Care, in offering what we're now offering as a pilot program with members who'd like to try it out. We have had one call come in after hours in which the person needed some personal reassurance to contact 911 due to a health event that had occurred. This provided great peace of mind for that member. Other times we've had members who may have had, say, a smoke alarm battery going off and didn't want to listen to that throughout the entire weekend. So that member would have access to someone who could contact one of our handymen who could, or a volunteer who could come over and repair that after hours. That's an example how members continue to donate their ideas, their time, their expectations, and giving us ideas of what they need and how we as a village can respond to that. Social events and educational events are offered based on suggestions by the members and their interests. Many are given by members themselves as presenters. We have some coming up in November by 2 members, Life's a Daring Adventure, Carpe Vitam. This is a wonderful program coming up, and I encourage you to check out our website to find out more about that. But we have talents just unimaginable, and we're so grateful when members share those with others. We have services. Probably the most popular benefit we offer at SAIL, I would say, or most used, I would say, are this access to vetted service providers. One thing we learned early on is that people were becoming more and more concerned about who is walking through their front door to provide a service. So we at SAIL and other villages provide this as well, is we basically vet or screen service providers. So our members know who they can call, who has been screened and or recommended by other members. This has been a wonderful service to members. We've had members who have told us that they don't know what they would do without us and without that service. They get to know the service providers. We meet them in advance. We basically have a rule of thumb. Service providers are people that we ourselves would feel comfortable opening our door to and having in our home. We also do extensive background checking and reference checking with our service providers. They help members with outdoor chores. They help members with personal care, personal assistance. We have handymen, window washers, chefs, professional chefs, organizers, advocates, and so forth. This is a wonderful service of the village. I mentioned, I should go back, direct services that we offer through the village office. Those vary amongst villages as well. But most of the time, you will see village offices doing a great deal of advocacy, reassurance calls, connecting members to services or professionals or experts who can help them out. And also things like tech support. Our village office and our service providers have been providing a great deal of tech support, especially during the pandemic. And that is a definite service need that will continue to grow. But the direct services are those offered by the village staff. And as I mentioned earlier, the model is based on the fact that not all 500 members will be needing or asking for assistance on any given day. That allows us to get to know members personally, to be able to assist them in an individual way. Oh, am I done? Sorry about that.
And we have about 3 minutes yet to the hour.
Yeah.
And if someone, as this is all of Wisconsin, hopefully listening, if someone within Wisconsin would like to start a village or formalize what they might be already doing, how do they do that?
So obviously we at Age Better in Sale would love to get to know anybody who is thinking about a village. I mean, with 15 years of experience, we can tell you definitely what works and what doesn't work. And then, of course, the National Village Network, that's another great resource. I will skip over to that. Oh, this I do have to show. This is Nancy, one of our charter members. And I love this quote because that really tells the story.
Mm-hmm.
So visit our website. And I will give, this is on the PowerPoint, by the way. So the Village to Village Network, here's the website, vtvnetwork.org. And they actually have like a beginning level or an intro level of membership for people to join if you're looking at developing a village. Believe me, with 280 operating villages, you can save a lot of time and angst by kind of learning from the mistakes and the successes of those villages. And it's a wonderful network to belong to.
Excellent.
Yeah.
This has been tremendous. For those that would like to download the PowerPoint presentation, it's shown in the handout section on the right. Please do so. It gives a lot of great resources